Okay, so selection criteria and specifically looking at the Grad Connect selection criteria. And I'm going to do this in two parts just because there's a bit to go through and I don't want to make this too long and boring for you. So, the first thing is kind of like you're going, what is the selection criteria going to be? And they only release the selection criteria once the application's open, once there's a valid job to apply for. That being said, they're always this super similar. They really don't change the selection criteria very much. The last time they made a significant change to the selection criteria was when the nursing standards changed. So last year they tweaked the fourth question. It was slightly different to the previous year, but they're all really pretty similar. And even if the selection criteria ends up being completely different, if you've practiced answering selection criteria, you'll be better positioned to answer the new one, even if it's completely different to what you anticipated. So the first question for the first selection criteria for the past couple of years has been demonstrated clinical knowledge and experience in the delivery of evidence-based nursing care within the practice setting. So you're going to demonstrate, you need to provide examples, and the things that you're demonstrating are clinical knowledge, experience, the delivering of evidence-based nursing care, and the fact that you're doing this in the clinical setting. So the first thing I would do if I were you is if you do not have a good working knowledge of what evidence-based nursing care actually is, like a good definition of that, other than, well, theoretically all the nursing care we provide is evidence-based, Google it, look into it, read a couple articles on what evidence-based nursing care actually is. And this is about clinical knowledge and experience in the clinical setting. So you need to give examples from your clinical placements. Hopefully you all realise that, but just in case. The other thing is, so think about all the things you do, these can be very mundane things, but they're evidence-based. And you can have more exciting examples if you have more exciting examples, but they don't need to be wildly exciting. Just a few examples of the things that you do that are evidence-based are hand hygiene, aseptic non-touch technique, wound dressing choice, like your IVC, PIVs, VIPs, cannula care, your catheter care, all of those just kind of standard nursing care things all have evidence that support them and surround them. And the other thing is find the evidence that supports your example. It doesn't need to be like super in depth. You don't need to be referencing it as per APA. You don't need to include a reference list at the end of your selection criteria. But it's the difference between writing things such as, I dressed the wound using a hydrocolloid dressing as advised by my preceptor, which does not demonstrate that you can use evidence-based practice, versus, I applied a hydrocolloid dressing as research shows that these decreased healing time by 20% and increased patient comfort where there is a dry granulating wound bed. Now, FYI, for this example and all the examples that I provide in the slideshow, one, don't just copy what I've written, like seriously don't, this is your selection criteria, you need to use your examples. Secondly, half of the statistics, like I've made them up for this PowerPoint. Some of them I have actually Googled it and researched it, some of it I've just made up for the examples. So you are going to look like an idiot if you do copy mine and use my made up examples, because they're going to know when they're reading your selection criteria. So this is an example of a good selection criteria. Now, I want to clarify, this is not the perfect selection criteria. This is not the best selection criteria that's ever been written for this. This is just an example of some of the elements that might be involved in a good selection criteria. So, at university, I have learned about evidence-based practice, where best available evidence is combined with clinical knowledge and patient values to ensure the highest quality and safest care. This means that nursing care is dynamic and adaptable as new research evidence becomes available. The following examples demonstrate how I have applied evidence in my nursing care whilst on clinical placement. Now, for this particular question, I have included a definition of what evidence-based care is, because the question is asking you to demonstrate your knowledge as well as your experience. And for me personally, my interpretation of that is you want to include the fact that you know what evidence-based care is, and that means a definition. So whilst on my clinical placement, I admitted a patient who had presented with pressure injuries on their heels. I assessed this evidence using the NPUAP, EPUAP pressure injury staging system and identified that these were stage 1 pressure injuries. With my buddy nurse, I organised for the patient to be transferred to an alternating pressure mattress bed, as a 2015 Cochrane review found that this can reduce pressure injuries compared to a standard foam mattress. I also applied Meplex dressings to the patient's heels and sacrum, as a 2016 literature review found the use of silicone foam dressings reduced the incidence of pressure injuries by 42% compared to standard pressure injury management alone. By taking these actions, I was able to reduce my patients' risk of developing further pressure injuries and potentially worsening their existing injuries. So this isn't a completed selection criteria. There's still a bit more word count. This can still be further developed. This is a bit more of a kind of in that first drafty kind of stage. But here we're showing that I'm aware of what the evidence is surrounding the particular issue that I'm faced with in my nursing care, and that I've implemented and applied that evidence to the nursing care that I've provided. So what might be a bad example? So at university, I've learnt about providing evidence-based nursing care, and I ensure that I use evidence in all the nursing care that I provide. Whilst at university, I practice inserting a urinary catheter using aseptic non-touch technique. This included using chlorhexidine wash to clean the introitus and using sterile gloves, as well as ensuring I did not contaminate anything whilst inserting the IDC. I also learned how to perform a wound dressing using aseptic non-touch technique. Whilst I was on clinical placement, I looked after a patient who had 2 IV cannulas. I made sure that I flushed the cannulas using a turbulent flush motion, and that I cleaned the cannula hubs for 15 to 20 seconds prior to accessing the cannula. I also assessed each of the cannulas and recorded a pivot score for them. I changed the cannula dressing for one cannula as it was dirty. Why is this not a good example of addressing the selection criteria? So first of all, the question is talking about you providing care in a clinical practice setting. So you're not going to be you might mention that you've learned about evidence-based nursing care at university, but you're not going to provide examples of how you've used that in the university clinical labs. You need to provide examples from clinical practice, which should hopefully be very obvious, but just want to flag that one just in case. The other thing is that the writer in this example has not provided any evidence of support or why these things are done. So they've mentioned lots of things that aren't evidence-based. For example, the use of sterile gloves whilst inserting an IDC, of using aseptic non-touch technique when doing a wound dressing, doing a scrub the hub when you're accessing a cannula, doing a pivot score for a cannula. There is evidence that backs up all of those actions, but the writer of this selection criteria, which is me in this, but anyway, hasn't provided any understanding or hasn't given the reader of the selection criteria the feeling that I know that the evidence does support those actions and that I know where the evidence comes from and how to integrate evidence into practice. So, for example, a better example might be, rather than saying prior to accessing the IVC, I scrubbed the hub for 15 to 20 seconds, I might go, prior to accessing the IVC, I scrubbed the hub for 15 to 20 seconds with a chlorhexidine alcohol wipe and allowed to air dry, as the evidence shows that this technique can lead to a 50% reduction in IVC-related infections. So here I'm showing that I'm aware of the evidence that supports the actions that I'm taking, and I'm not just taking those actions because I've been told at uni that that's what I need to do. So, the next selection criteria that often comes up is demonstrates effective interpersonal negotiation and conflict resolution skills. So again, you're demonstrating, you're providing a clinical example, and it's talking about interpersonal negotiation, conflict resolution. Interpersonal, fairly easy. You're going to talk about how you've dealt with other people, which is basically everything you do in nursing. And you're looking at negotiation and conflict resolution. So it may be worth, for your own interest, just looking up a brief definition of these just so that you can get in your head what they mean. And in terms of that negotiation and conflict resolution, it's worth looking into if you're aware of, or if any of the hospitals that you've done placement at use any of like the graded assertiveness models. So you'll see things like speak up for safety or PACE, or they're all part of this kind of way of negotiating and conflict resolution within hospitals. So Speak Up for Safety is a specific program that runs using the PACE model. But if you're aware of any of these kind of models, it is worth mentioning a framework that you might use for negotiation and conflict resolution. I would suggest ideally, potentially for this, you might want to use 2 examples, one that focuses a bit more on negotiation, one that focuses a bit more on conflict resolution. That being said, if you have one example that beautifully encompasses both of those, you don't have to use 2. Or, if you happen to be able to fit 3 examples into your word count, that's fine as well. So again, sit down, just brainstorm. Think of all the different times when you've had to negotiate or resolve conflict whilst you've been on placement. So this is kind of another example of what I would classify a good example. Again, it's still very much in the drafty form, needs a bit of tweaking, but just to kind of give you a bit of an idea. So nursing is a profession which requires the nurse to be skilled in negotiation, conflict resolution, and establishing effective interpersonal relationships. Whilst on clinical placement, I bladder scanned a patient post-void who had a 650 ml residual. I let the doctor know about the patient's residual volume, and they told me to continue to monitor. However, I was concerned that the patient didn't understand me that the doctor didn't understand me correctly and thought that that was the patient's voided volume. I decided to use the PACE model of graded assertiveness and approached the doctor again to let them know that I was concerned, and I wanted to clarify whether the doctor had understood that the patient had retained a 650 ml volume. Once the doctor was aware of this, they gave instructions for an IDC to be inserted. And then I'm going for a second example. Whilst on clinical placement, I cared for a patient who was refusing an IVC despite needing IV antibiotics for their cellulitis. I sat down with the patient and gave them time to express their concerns with receiving IVABs and discovered that the patient was scared of the pain of the IVC insertion due to previous traumatic experiences. I explained to the patient that we could use a topical anaesthetic and the patient agreed to have the IVC inserted. I organised with the medical team for the topical anaesthetic to be prescribed and administered to this patient. The patient was cannulated and received the required IV antibiotics. So here I'm showing, different conflict and negotiation with both colleagues and also patients. So some bad examples. A bad example is, it is important for the nurse to have good skills in negotiation and conflict resolution. Negotiation is about having a discussion with the goal of reaching an agreement. Conflict resolution is a process by which two or more parties come to a resolution for a dispute. Both skills are important for the nurse as they have to deal with patients, families and colleagues throughout the day. Whilst on my nursing placement, I looked after a patient who was palliative. Their family was very concerned that the patient wasn't receiving enough pain medication and became aggressive towards the nursing and medical staff. They were yelling on the ward and disturbing the other patients. The nurse and I gave the patient more pain medication and the family stopped yelling. Why is this a bad example? Firstly, I would say for a question like this, you don't really need to provide any kind of in-depth definition or anything of the terms because it's not asking you to demonstrate your knowledge of, like the previous question was. If you feel it is important to your answer, it's not a bad thing, but it can be a little bit of a waste of word count. The other reason is the example that this person's provided it's an example of where there's conflict, but hasn't really shown much negotiation. There is a resolution, but it's not a particularly effective resolution, and it hasn't shown a lot of interpersonal skills. So, for example, a better answer to this for the same scenario might be, I looked after a patient who was palliative. The family was concerned that the patient wasn't receiving enough pain medication and became aggressive towards the nursing and medical staff. They were yelling on the ward and disturbing other patients. The nurse and I requested that the family please stop yelling and showing aggression towards us and explained that we were happy to discuss the plan for the patient. We let the family know that the palliative team had just reviewed the patient and that the patient was being commenced on a NICU pump, which was going to provide a continuous stream of pain relief to the patient. We also explained that in addition to that, we were able to provide more pain relief for any breakthrough pain and invited the family to be engaged in the care of their loved one and to let the nursing team know if they had any concerns at all about the patient's pain and pain management. The family was much happier once they knew that their loved one was being looked after and were happy therefore to engage with the nursing staff in a respectful manner in order to ensure a pain-free outcome for their loved one. So that kind of is more showing, they're showing negotiation, effective negotiation to reach a resolution, and in a way that shows that you're listening to them, you're de-escalating the conflict and you're addressing their concerns.